Today we'll be hearing from Dr. Régine Sitruk-Ware. Régine is a world-renowned reproductive endocrinologist who has helped to revolutionize contraception for women and men. She's received numerous accolades, including the 2022 Society of Family Planning Lifetime Achievement Award, and is one of Time Magazine's 50 most influential people in healthcare of 2018. Now, the Population Council likes to boast that more than 170 million women around the world use contraceptives developed by us or based on our technologies. But what about men? Régine will speak about groundbreaking research in the area of male birth control and how the Council is advancing gender equality by making family planning a shared responsibility. Régine, the floor is yours.
Thank you. Thank you very much, Chichi. And I'm really honored to share with you the update on this important project. And as you say here, I mean, men have been neglected in research made on contraception. And as you know, men so far have only condom or vasectomy, non-reversible. And it was really time for gender equity to develop a male contraceptive. On the next slide, it indicates why we choose this transdermal gel containing Nestorone and testosterone for male contraception. We wanted to develop a user-controlled method for men, provider-independent, user-friendly, and this would allow men to take responsibility for their reproductive behavior, and as I said, and you said, promote gender equity. The gels, when applied on the skin, develop stable levels of the hormones, and this avoid peaks and troughs, and it's more efficient in this way and can induce less adverse events. And it was known that, at least in the United States, the testosterone gel was really preferred by men for testosterone replacement to compensate for hypogonadal symptoms. And therefore, we knew on that front that it was acceptable to men. The next slide indicates what we have developed. And the studies we have started since the beginning of 2005 and 2006 were several studies. All the program has been developed in strict collaboration with the National Institute of Health and NICHD and their team. We had a first dose finding study where we tested two different gels. We had a Nestorone gel produced in the laboratory of the Center for Biomedical Research in New York, and a testosterone gel from the markets that were associated. The man had to place one gel on the shoulders and one gel on its belly. And we found a dose that was the least, creating the least side effects and very well active. Then we went to a 6-month study of suppression of sperm production in healthy volunteers. And then, for convenience, of course, we had to demonstrate we could put both hormones in the same gel in a small quantity, and we succeeded to make it in 5 milliliter per unit. And this has delivered the same levels in blood as the two separate gels. We also studied how to prevent secondary transfer of the hormones from the male to female or other people. And this has been published and is required by the FDA and other health authorities. And currently we are having ongoing a very large study. It's the only study ongoing for male contraception at the moment with two combined hormones, Nestorone and testosterone, in the same gel. And it's a phase 2B, as in fact it's used in couples who are volunteering to use it as a contraception. The next slide shows you the commitment and why we think the gel is efficient based on the preliminary information. In all studies we have seen on sperm count, most men, 90%, suppress the sperm at the threshold level below 1 million per milliliter, which is known to be effective as a contraceptive. The adverse events reported were minor. Still, there were some complaints of acne or weight gain, insomnia, mood change, depression, skin reaction, and all minor and moderate. We know now that the time to suppress is about 12 weeks, but some men suppress already at 8 weeks. And it remains suppressed when compliance is correct and during treatment. And at withdrawal of treatment, recovery occurs in about 12 weeks. The next slide would show you now how the man applies the gel. The formulation is in a canister, so you have both hormones combined. And you can see in the second picture the small amounts on the blue paper, which is 2.5 milliliter, half a teaspoon. So the man would place one of these doses in his left hand and place on his right shoulder, and then he placed another dose on his right hand and rub it on his left shoulder. And the area of application can be small or larger. It doesn't matter. We have shown that the serum levels are similar. So it's rubbing it and letting it dry. Next slide is describing the phase 2B design and where it takes place. And in the map, you can see that there are now 17 centers involved in this study. And this is, as I said, collaboration with NICHD and Population Council, several centers in the United States, 4 in Europe, 2 in Africa, 2 in Chile. And we have a commitment of the couples for 2 years. So first, there is a suppression phase, and we have to reach this 1 million per ml of sperm count, which is reached, as I said, at 8 or 12 weeks. In this study, we went up to 24 weeks to give a chance to some men who were decreasing to reach this threshold. And then they enter into the efficacy phase where the woman stops her contraception and the couple relies only on the gel taken by the man. And then at withdrawal, they have to enter in a recovery phase up to 24 weeks. So we targeted to enroll 420 couples. We have enrolled more than that, 460 couples. The target was to have 200 couples completing 1 year of efficacy. And at this very moment, we have 115 couples who have completed this year of efficacy. We measure, of course, the main effect on preventing pregnancy and safety and acceptability to both partners. The next slide will show you that we have future steps, and we are preparing a package to submit to the FDA as an end of phase 2 meeting, even though we have not reached the end of this phase 2B. But given the very promising results, and by the way, we have 0 pregnancies so far, we wanted to provide this preliminary data and prepare. We have prepared a phase 3 protocol that we want them to review, and we hope to get them to approve the start of this phase 3 before the end of phase 2B by the second quarter of 2023. The other goal of our meeting, we would like to have only 1 large trial, 1 phase 3, rather than 2 phase 3 as usually requested by the FDA and other health authorities. Now, if this is successful, this gel will become the first male hormonal contraceptive method available. And all the negotiations we had with the FDA and other health authorities in the various countries where the study is taking place is paving the way for other male methods. There are no guidance for male contraception, and what we have achieved may be future regulatory guidance. Next slide is showing you that the media coverage was very, very wide. In fact, many newspapers have mentioned the study, and many quotes have been represented, and here are a selection of it. And in Wired, we have Dr. Crennan, one of the key principal investigators, saying one of the things we've seen with this study is this realization of how important this is to men who are in relationships and care about their partner. In Nature, Risha Anderson, who is in Edinburgh, say that phones were ringing off the hook with people wanting to take part as soon as the announcement was made. In Reddit, one of the participants in the study said really very enthusiastic comments. He said, the control I was able to have over my own fertility felt incredibly empowering, and it is something I will miss dearly. Reproductive equality is missing from sex, and I think trials like these are so important. I spoke to many reporters, and one of the quotes that they took in Euronews was that I mentioned that, of course, when you apply the gel, it remains within the skin, and there is a slow diffusion, and we measure that it's active over 72 hours, 3 days. And that means that it may have a kind of forgiveness for men who may forget 1 dose or 2 doses, but no more. So I would just show you now in the next slide all the various groups who are working. It's really a big undertaking. There are several teams involved, and each of the groups, many people at the Population Council, at NIH, and the 2 main investigators at UCLA and University of Washington, each of them coordinate 5 or 6 centers all over the world. Thank you.
Thank you very much, Régine, for your presentation. We know that this trial has generated a lot of attention, and it really contributes to the ongoing conversation about gender equity and reproductive health. So thank you for that.
Thank you.